What kind of things would you not recommend this scan for?
Some people come in with just general pain and they might have arthritic knees or arthritis as their main issue. And for joints and for musculoskeletal issues, you're going to get a much higher detailed scan of a specific joint. So say a knee, for example, we're looking at much thinner cuts, much thinner slices, looking at the cartilage in specifics. You can do cartilage mapping, all sorts of other quantitative things on the joint itself. But the type of detail we get of very small detail of joints is something that you need to assess for sports injuries, arthritis, all sorts of things like that. For the spine in particular, we have a really nice general look at the spine in our whole body MRI. However, to look at a spine specifically, we actually take a quantitative approach or a contrast approach to look at the function of blood supply there. So if we're looking for sensitivity to pain or to sensitivity to inflammation coming from either an annular tear or a bar straps or inflammation around the facet joints, these things are all very specific. And most patients, if you were to scan them every 5 years without back pain, you're going to show changes. When they show up in pain, the one great thing about an MRI is it shows everything. One of the bad things about MRI is it shows everything. So being able to be more specific about where the inflammation or pain may be coming from, we have other tools to help with that. So when it comes to dedicated scans of spines, joints, like knees, shoulders, feet, toes, small areas, it's much more appropriate to have a dedicated scan of those regions. When we do a whole body MRI, when we see signs that there may be changes there that are going on, this is where Zane would then recommend a dedicated scan in those regions. We'll often pick up signs of things, but it often leads to a dedicated scan. To have detail of minute scans of 1 to 1.5 mil cuts through a joint with sub-millimetre in-plane resolution, to do that over the whole body would take longer than a day. So when we're looking at that type of detail, we need a focused exam. For whole body screening, it's extremely high detail, but to do the whole body in that amount of time, we have a balance of what we're actually detecting versus what we're actually looking for. So to look at specifics like musculoskeletal sports injuries, arthritis, and areas like that, this is where dedicated scanning is much more appropriate.
So it's not a catch-all. There is no test in the world that will catch everything. So primarily asymptomatic patients, wonderful test. But if you have specific symptoms, a specific test is always better. We'll always pick up more.